Hi, Jasmine. So, I understand that you're coming in for some birth control today,
Yes.
and my job is to help you find something that's going to be best suited for your needs and kind of what you're looking for, okay? I want to start off by just telling you that your visit with me and everything you disclose here today is confidential, and that means that it's private, okay? There are some instances where that wouldn't apply, and that's going to be in the case that you tell me that you're hurting yourself or thinking of hurting yourself, thinking of hurting someone else, or you're having sex with someone who's much, much older than you, or having sex with someone who's much, much younger than you.
Okay.
In these cases, the law states that I have to report that to someone. Anything else that you disclose with me stays between you and me. I cannot, by law, disclose any of that information to anyone else.
Okay.
So I want to start off by first kind of just getting you the idea of what you're looking for and what you already know about birth control. Once you tell me that, we're going to kind of go over all the birth control methods, and then you're going to tell me which one sounds best for you.
Okay.
Once you find out which one sounds best for you, I want you to be able to understand how it works, how effective it is, and any complications or side effects that might be associated with the birth control you might be thinking of trying. Okay?
Okay.
So that's kind of where how we're gonna do this visit. Okay? So I want to start off by you just telling me what you already know about birth control and what it is you want to achieve with your birth control. What are you looking for?
Okay. Well, I know some are more effective than others, and they range in the time frames that they work. So I want something that is maybe long-term, and I don't have to worry about taking every day or possibly having to change or come in every couple months, maybe something that more than a year or so. I
Right.
think that'll work better.
Okay, so it sounds like you have a pretty good idea of what you're looking for, and you just need a little bit more information to fill in all those ideas.
Mhm.
Okay, so let's start by looking at this chart. It's an excellent chart that illustrates how well different birth control methods work, because you're absolutely right in the fact that some are more effective at preventing pregnancy than others are. Okay, so at the very top, we have in green the most effective birth control, and that's going to be the 2 IUDs that we offer. Here there are 3, but right now we're only offering 2. One of them we haven't been able to get into the organization yet, okay? And we also have the implant, an implant that goes inside of your arm, okay? And sterilization, but sterilization is for women who already know that they no longer want to have any more children, okay?
Okay.
It is a permanent procedure. So the 2 IUDs are very effective. They're sitting at about 99.8% effective. That means that less than 1 woman out of 100 that use this in the first year are going to get pregnant, okay?
Okay.
And then we have the implant, which is the most effective birth control on the market right now in the United States. It is about 99.95% effective, and this means that far less than 1 woman. It's 0.05% away from being 100% effective. So less than 1 woman out of 100 are going to get pregnant in the first year that they use it. Okay,
Okay.
so by far the most effective birth controls. Lower down on the list, we have the progestin or the Depo-Provera shot. This is a shot that lasts for 3 months. It is also pretty effective, about 97% effective. Okay, so
Okay.
that means that about 3 women out of 100 are going to get pregnant while they use this. And then you already mentioned that you don't really want to do anything that you would have to do continuously, which would be the lowest tier on our scale. So out of those, knowing that the shot you'd have to come in every 3 months, what do you think you would want to talk a little bit more about?
I think I'd be interested in either the implant or the IUD.
Okay.
I want more information on this.
Okay, so the implant, as I said, is the most effective birth control, okay? It's a very simple procedure. Do you already know of anybody who has the implant right now?
I have a friend. She
Okay.
seems to like it.
Okay, she likes her implant. Okay, so good. So it's a very simple procedure, okay? We're basically going to put a shot in your arm, and it's going to numb this part. It's only going to numb this part of your arm, okay?
Okay.
And that's all you're going to feel, all right? And then we're going to put another shot in your arm, and that's going to have the implant in it. We take that needle out, and the implant stays inside of your arm, okay?
Okay.
It would take a total about 5 to 10 minutes for the procedure.
Oh,
So it's
great.
pretty fast. This is what the implant looks like, okay? So it's just a rod that has hormones inside of it.
Oh, okay.
And this is
Not
what
bad
it
at
feel
all.
like once it's inside of your arm.
Oh, you can barely feel it.
That's right. So this form of birth control lasts for 3 years. And it has a hormone in it called progestin hormone, okay? Progestin hormone is naturally made by your body as well. And what progestin hormone does is it causes the menstrual cycle, what you know of as your period, to start. Okay? So the menstrual period is a whole cycle that happens throughout a whole set of days. Okay? And I like to use this model because I can illustrate to you really well how your birth control is going to work as far as preventing a pregnancy.
Okay.
Okay, so progestin hormone, let's start off by, my uterus fell. So the uterus builds a lining every single month, okay, in preparation to have a baby, all right?
Okay.
And so what progestin does is it triggers that lining to be excreted from the body as your period. All right? And since this implant has more progestin hormone in it, it's going to cause that lining to start shedding and coming out as your period. That process is going to take approximately about 3 months. Okay? So you can probably rest assured that you will have lots of spotting, much more spotting days than what you're used to, especially for the first 3 months.
Okay.
So that is one way that it's going to work, okay? But the primary mechanism of action, which is how it works at preventing pregnancy, is every single month your ovary spits out an egg. And the egg just hangs out right here inside of the fallopian tube, waiting for sperm to come, fertilize it, and implant inside of the uterus, okay? So what the hormone that's in the implant is going to do, it's going to tell that ovary, hold on to that egg. That's what we call preventing ovulation, which means the ovary just holds on to the eggs, doesn't spit them out. So as you can imagine, if there's no egg sitting in the fallopian tube ready for fertilization, there's no baby that month. Okay? So that's the main way that it's going to work. Okay? Secondly, it forms like a gummy paste that sits on the tip of the cervix. Okay, so it acts like a plug. Okay, that way when you do have sex, the sperm cannot go beyond the back of the vagina. It stops it from being able to get inside of the uterus. Okay? So that's another way that it works. Do you have any questions so far?
No.
All right. Do you know how we're going to actually put it in your arm? Do you have any questions about that?
Does it have any side effects? Will I be in pain for a long time? Or?
Okay, so it's not really very painful, okay? Afterwards, I hear a lot of people saying that it's a little bit sore, okay? But you can resume all regular activities.
Okay.
The time that they place it, you are going to have to touch and feel and make sure that you feel it there so that you know that it's in place. It's going to feel like this, okay? That way you'll know if it falls out. Because obviously if it's not in your arm, then you're not on any birth control and you can get pregnant, okay? You're also going to experience having a pretty large bruise on your arm. Most people say that that bruise does not hurt, okay? But it is an impressive sized bruise, so you can expect that. Okay. Any other questions about how we're going to place it or how it works as far as preventing pregnancy?
No, I think I'm sold.
Okay. So another thing that I want you to know is that it is not going to help against sexually transmitted infections. Okay? It's excellent at preventing pregnancy, but it is not going to help with sexually transmitted infections. The absolute only way for you to do that would be how? Do you know how you would help prevent sexually transmitted infections?
A condom?
Yes. So using a condom every single time you have sex.
Okay.
Every single time you have sex, the whole time you're having sex, okay? Not just at the beginning, not just at the end, the whole time and every time you have sex. Okay? And that's the best way to prevent sexually transmitted infections. I also want to let you know that your implant will not be working for the first 7 days. Okay? So once we put the implant in your arm, it is super important that you use a backup method like condoms. Okay? For especially the first 7 days, because it takes 7 days for that hormone level to reach that perfect level where it's preventing ovulation and that mucus plug has been formed on the cervix. Okay? Any questions about that? Okay. So what are you going to do to help prevent pregnancy after the first 7 days after you
use
your
a backup method?
Okay. Like what?
Like a condom.
Okay. And we have those available here too, and we can send you home with some condoms today. Okay?
Great.
So that is about how the procedure goes. Okay? Any kind of side effects, mostly what I hear of are going to be the periods. Okay? Some women will experience spotting the whole time that they have the implant in. Okay, so for the whole 3 years, some women can experience that. Seek your care provider, your personal care provider, okay? If you happen to be that woman, because there are some things that they can do to help you with the spotting, okay? So that you have the great birth control in your arm and they're just getting rid of the spotting. Some other very mild complications can be nausea or stomach ache. Usually we don't hear of those very often, but some women do experience that. Okay. Those are side effects. They are not life-threatening. They will not harm you in any way. It's just a simple side effect that's being caused by the hormone that's in the implant. Okay. Now, complications are very rare, but can be life-threatening. Okay? And some of the complications with the implant would be like it falling out or it getting infected. All right? So when we place it, it should not feel red, hot. You shouldn't see pus coming out of it. If you start to notice any of this, seek medical attention because that can be a complication of the implant. And it can be harmful to your, it can be harmful to your life, okay? So then, very rare, I've never seen it happen, but you should know that that is something that could happen. Okay? So, do you have any more questions about the implant, how it works, how you're going to protect yourself for the first 7 days, anything like that?
No.
All right. So then it was been a pleasure to meet you, Jasmine, and I will help set you up with an appointment to get the implant.
All right. Thank you. The right button. What?
I'm standing. I'm trying to press the thing.